Hi, I'm a dietetic intern at ETSU, and my name is Jennifer Schmidt.
I'm also a dietetic first-year intern at ETSU, and my name is Jessica Bevan.
And today we're going to talk to you about hypertension, and it's also been called the silent killer. And this is because some of the symptoms aren't as noticeable as, let's say, diabetes or a stroke or something like that. They're very subtle, and most people can't detect it unless they go to the doctor. So first, we have a little quiz for you if you want to just answer these questions on your own, and then we'll go over the answers in a little bit.
So first we have pretzels and potato chips. Which one do you think has more sodium in it, more salt?
Chips.
Chips?
Any other guesses?
I say chips.
Actually, it's pretzels. They have more sodium than regular potato chips do. Kind of interesting. What about a salad with ranch dressing or a salad with Italian dressing?
Italian dressing.
Ranch. It's Italian dressing, has more sodium in it. What about pasta with Alfredo sauce or pasta with marinara sauce?
I'm going to pick Alfredo.
Alfredo is correct. What about, we have turkey slices or ham slices?
Ham.
Ham is correct. And then we have tomato soup and chicken noodle soup.
That's a tough one.
That is a tough one.
I say chicken. Tomato.
It is tomato soup.
Tomato soup has more sodium.
And then we have teriyaki sauce. This is the teriyaki sauce and soy sauce, regular soy sauce.
Teriyaki. Soy.
It's the soy sauce. Has a lot of sodium. So when you get soy sauce,
low sodium.
you can buy low sodium teriyaki sauce, and they do have the low sodium options when you go to Asian and Chinese restaurants that you can choose from.
Yeah. So we took your blood pressure earlier, if you remember, and I think you had a blood pressure of 140 over 30, which is a little bit high, but if I understand correctly, you've just started medication for your hypertension? Okay. Well, when we talk about 140 over 30, that's kind of a confusing number. You've got two numbers there. Were you over 90?
Over 90.
Over 90.
It was 90.
30. I don't know where I got 30 from. Okay. That would be really low. So your systolic number is that's the higher number, and that's when your heart contracts. So when it's really high, your heart's having to work a lot harder to pump that blood. Your diastolic number is that bottom number, so it's that number right there, and that's when your heart rests. So we took your number. Just be mindful of that, especially monitor it while you're taking that medication, and hopefully we'll see it go down. But you also need to make some lifestyle changes. So.
And we'll talk about those lifestyle changes in a little bit. All right, so some of the risk factors for hypertension include a family history. Genetics is a big role in hypertension. Advanced age can also affect it. Physical inactivity and obesity. You have different ethnicities and races have higher prevalence and incidence. African Americans are the ones that have the most common rates of hypertension opposed to other races such as Caucasians and Native Americans. Gender also plays a big role. When you first start out, the younger ages, so like 20 to like 45, men have a higher prevalence than women. And then when you get into like 55 to 65, it's about similar rates between men and women. And then as you get older, women have higher rates than men. But in general, when you're older, you just have higher rates of, there's higher rates of hypertension. Also, poor diet and alcohol intake, excessive alcohol intake can lead to hypertension. And some other ones that could cause it would be stress, smoking, and sleep apnea.
So what can happen when you have a really high blood pressure? Like we said, it's the silent killer, so a lot of these things come up and you don't even know that it's happened, and people don't take their numbers seriously because they don't feel it. They feel fine. They don't feel like they've got high blood pressure until it's too late. So you can have a heart attack or stroke, and again, that kind of comes out of the blue. A lot of people just don't know that they've got such a serious problem until it's too late. You can have heart failure if you take it too far and you don't take care of your body, and then death. So.
All right, so what can you guys do today that you can lessen your risk or even just reduce your blood pressure if it's high, like 140/90 is hypertensive? So some of the big ones are the DASH diet, which Jessica will go over next. Increasing your physical activity, so just walking a few extra steps every day, or walking to the grocery store, parking a little bit further and walking into the grocery store. You can avoid smoking. If you currently smoke, best to try and cut back as low as you can until you can just quit smoking, since it has been shown to help lower your blood pressure. And also limit alcohol intake to the recommendations. So that's 1 drink a day for women and 2 drinks a day per men.
So the DASH diet was developed by the Academy of Nutrition and Dietetics for hypertension patients, but it's actually just a general healthful diet that every single person should follow. It's not completely restrictive, so it's easy to follow if you just take some simple steps to do so. First of all, you have 1,500 to 2,300 milligrams of sodium per day. Which is a really easy amount, but you got to be careful because sodium is hidden in foods like canned foods, frozen foods. Any processed food has a lot more sodium than you think. Does anyone know where to find the sodium content in foods?
Nutrition label?
Yeah, the nutrition label. You'll see sodium and it'll tell you your milligrams. I tell some clients all the time, make a table. Just write down your sodium content every day. And once you get into that habit, then you're going to be able to slowly kind of understand the foods that you're eating and how much they have. And it'll be a lot easier for you to follow. The next thing is to have 7 to 8 servings of grains per day and at least 3 be whole grains. We recommend that all your grains be whole grains if you can, but it's really hard to follow that sometimes. But just slowly start, adding those whole grains. So instead of white bread, you can use wheat bread. Pasta is an easy one to change. So instead of going to the white pasta, just change to wheat pasta, things like that. 4 to 5 servings of fruits and 4 to 5 servings of vegetables per day. Take them as a snack, have a fruit in the morning, and then for your snack have celery, things like that. 2 to 3 servings of low or non-fat dairy. Who has whole milk in their refrigerator? Nobody? Good, great.
Skim milk.
Skim milk is great. That's what we're looking for. Skim milk, 1%, things like that. If you are a whole milk drinker, then slowly lower it. Maybe mix the 2% in the whole milk and then mix the 2% and the 1% and slowly lower. And you'll get there, I promise. And then you won't notice that it's skim milk. 2 or a few servings of lean meat, fish, and poultry per day. Try to stay away from having those really high fat meats, the big huge steaks that are marbled with the fat, things like that. Fish, tilapia, salmon's a great one because even though it has the fat, it's an omega-3 fat, so it's really healthy fat for you. 4 to 5 servings of nuts, seeds, and legumes per day or per week. These are things like your almonds, things like that. And lastly, limit fats and sweets. You don't have to have a sweet every day. You don't have to have the fatty things every day. It's really hard to limit fats and things that you don't think about. Think about the things that you're cooking in. So limit what you're cooking in. Maybe use the cooking spray, the PAM, instead, or use just a tablespoon of olive oil to cook in. Be very mindful of that because even when you go out, they're cooking in things that add fats. So.
Also, you want to be aware for the vegetables that you get. Fresh is the best option for you, but there's also the frozen vegetables and the canned vegetables. Who has any canned vegetables at home?
I do.
You do?
Canned green beans and carrots.
Okay. Are they, that you can buy the low sodium options as well?
Yes, but
Then
they're more expensive, so. And then what do I do with the cans that I have?
I'm glad you asked that question because what you can do is you can rinse your vegetables with water before you use them so that it gets some of that excess sodium off that they keep it in the juice with and cook with just water, and it'll just clean them and get some of that salt off for you.
And you don't have to waste the vegetables you have.
Exactly.
Money's tight nowadays.
Yes.
With the frozen vegetables and fruits, those are great too. Just be careful because a lot of the frozen fruits, they add sugar. So be careful about that. You can get just frozen fruit, which is great. With the frozen vegetables, a lot of times they add a butter sauce or things like that. Just kind of make sure that you are looking for those items where it just has like your frozen broccoli, things like that. So.
Do you guys have any other questions for us today? No?
All right.
Thank you for coming.
Yes, thank you.